you so much for joining. And we know that this is one of those precious weeks right before the 4th of July, so we're really excited to have such a great showing. All right. As I'm going to move forward and welcome to the patient tracking and family reunification focus area for today, July 1st. And again, thank you for being with us.
One of my favorite slides, the PPN is supported in part by HRSA of the US DHHS as part of several cooperative agreements. The content presented here is that of the authors and doesn't represent the official views of nor an endorsement by HRSA, HHS, or the US government. Next slide, please. There are no disclaimers by the speakers today. You will get more information about how to claim CE credit if you're interested near the end of the presentation. Next slide. As always, this is an ambitious group and we have many objectives, key components of effective drills, focusing on the importance of the drills in emergency preparedness, assessing strengths and gaps, and actionable recommendations. Next slide, please. Again, the agenda highlights our illustrious speakers and everything that we're going to try to cover today, which focuses on tabletop exercises and various aspects of those. I'll thank the speakers in advance. Next slide, please.
So we do have a poll to ask about our pre-session materials, which we'll walk through in just a moment. If you're on a cell phone, you can text ALIN1 to 37607, or you can join by web or click on the QR code, whatever is easiest. But the question is whether or not you've accessed the pre-session materials through the Padlet. And I can't monitor the chat, so hopefully somebody has put the pollev.com/ALIN1 into the chat just for ease of participation.
pollev.com/ALIN1.
Yep. Okay, we're going to move to the next poll, just for the sake of time. Pre-session materials have been useful. All right, I'm glad that they're useful for those who have accessed them. That's really helpful information to know. We may see these questions again in subsequent sessions. So we actually have heard from you. We very carefully look over session evaluations every single time after the session is over. So those are very valuable to us. What we have heard most from all of you is that having people share their own experiences with some of their successes and some of their challenges has been the most useful thing for you. And as we're kind of nearing the halfway mark of this collaborative, we're asking asking all of you to actually share one of your experiences with us. And so this is a code, a QR code that will take you to a sign-up sheet so that you can share your experiences, whether it's a success or a challenge. I know we're all at different stages, and so we're all here to learn from each other. That's what the collaborative part is in this disaster response collaborative. And so please do sign up to share. We do have the link to the Google Forms if you guys are unable to take a picture of this QR code. And highlights from the pre-session material. My screen is going to look a little bit weird because I do want to share our pre-session material here. Are you guys still seeing? Are you seeing the Padlet now? Great. So every session comes with a Padlet. This is like your single stop shopping for all of the pre-session materials. You can access the pre-session materials from our last session, and we add video, the video of our previous sessions. This time, we're actually highlighting drills and exercises. So there's a few resources here. The EIIC Pediatric Reunification tabletop exercise you'll see here. There's a video of a frustrated parent searching for a child that you can use in your exercises. And also this handsome actor happens to be Sarita's husband. So I'm putting that out there. He might need a Emmy Award for his performance there. And then this last resource is from Region 5 for Kids, and it's talking about their cross-border reunification tabletop. And again, we're all in different places and stages of planning, and so we have a lot to learn from each other. Going back. And so that's a quick walkthrough of what those Padlets look like. If you haven't accessed them yet, we have a whole bunch of them, and you can retroactively look at them. And we're working to get it onto our website along with our other session materials. We are so lucky to have Holly Erpenbach here with us today. Hopefully her IS issues, her IT issues have been solved. Holly is one of our, she's coming to us from Medical College of Wisconsin and Children's Wisconsin, my home state. So I'm really excited to hear about this. And then she is a clinical research manager at Pediatric Emergency Medicine and the project manager for the Region 5 for Kids Reunification Work Group. So please, a warm welcome for Holly here, and I will be advancing slides.
Thank you, Anna, for that warm introduction. That was super sweet. As she has preluded, my IT issues have not been solved, but we're gonna work through it. So again, my name is Holly Erpenbach. I am with Children's Wisconsin and the Medical College of Wisconsin, and I'm the manager of clinical research there for pediatric emergency medicine. But most importantly for this group, I am the project manager for the reunification work group with Region 5 for Kids. And I have been asked to give a presentation on this tabletop exercise that Region 5 for Kids put on. So if you'd like to advance the slide. So on May 15th, we had a Wisconsin-Minnesota cross-border reunification tabletop exercise. It was an exercise kind of first of its kind, but we basically got together and had a in-person and virtual aspect to this exercise, but our main objectives were to recognize how to prepare and manage reunification from a mass casualty event via simulation, test and revise your hospital's reunification policies and procedures during a patient surge, basically sharing what your best practices are, seeing where gaps are, and seeing how we can help work together to resolve them. And then just understand the hospital's integration into a regional reunification plan. Next slide. So we ended up doing a very basic scenario that took place in the middle of Wisconsin, where there was a place where a school field trip could take place, where visitors from Wisconsin and Minnesota alike would tend to be at. Multiple schools were at this location, and we are typically aiming for the age ranges of 3K, 4K, and 5K. And there was an explosion on site that occurred on a Thursday afternoon at 1 p.m. To start off the scenario, incident command had been set up. They have alerted multiple hospitals that they will be receiving multiple patients due to the volume and severity of injuries, that a majority of them were children. Estimate of 50 to 100, and triage has begun on scene. So next slide. If you would, this is just kind of pointing out like, general area, here are the kind of players of the hospitals and the local regional folks from that area were familiar. So kind of seeing how they tap in and could play with each other. Next slide, please. So I'm kind of going to go over what the breakout sessions were. So there were 3 breakout sessions in total for this tabletop exercise. First, we'll start with breakout session 1, which is pre-arrival. So next slide, please. One of the unique things about this exercise is we really tried to take into account pre-hospital folks, hospital folks, and then people and employees at the state and resource level. So the way that we ended up grouping our breakout sessions in person and virtually, we kind of split them into these 3 categories. So if you were associated with EMS, any emergency services, emergency management, you kind of hopped into the pre-hospital breakout rooms. And then there was hospital, obviously, like your emergency hospital managers, your different nurse and ED staff. That's where all of those were aligned under the hospital room. And then there were state and resources, which was a catch-all, but also incorporated the many different factors of what happens at the state level and who's all involved. So this would be like volunteer organizations, your healthcare coalitions, and folks like that. So these specific bullet points were all the questions that were asked of each group to prepare for that scenario. If you would like to advance to the next slide. I guess I went into this presentation kind of talking about the lessons learned. So one of the major things that we learned from this breakout session is that states have different bed tracking tools used by EMS and hospitals. So there's MN-Track for Minnesota, there's Y-Track for Wisconsin. They do not cross over. They don't really talk to each other. However, to ensure like liaison between both systems for bed tracking, we have kind of tossed out the ideal and kind of magical solution of a regional or common tracking tool such as M-Track by Juvari. That was one of the major things that was talked about how when tragedy strikes, they don't really consider where you're from. They just want to get you to the closest hospital to make sure that your care is of top priority. And so one of the things that we also learned is that the EMS agencies in the area are very comfortable with their cross-border transports. They do this on a regular basis, whether it's for actual emergencies or just for a regular medical transport. They're both very familiar with the area. Mayo has many locations in both states, and so that's a major player for Minnesota, but also for the upper Wisconsin region. And that through this collaboration, many agencies have templates and tools in place for these cross-border reunification attempts. So next slide, please. So this is breakout session number 2. And basically, had several injects. So we're going to talk about breakout session number 2 and number 3 kind of at the same time. So next slide. The way that we decided to do sessions number 2 is just like, all right, here are kind of our waves of patients. Here are our waves of what's happening, what's coming through you. Here's your new information. So the first group, it was 5 patients. For those who are familiar with the medical coding. So one red is a 5-year-old, so that means like major injuries. Yellow is kind of minor-ish injuries, like could be okay, but need attention soon. And then we also gave some assumptions, like make assumption that the school official accompanying the children assume that medical management is underway and focus on managing the process of identification and reunification. The reason we kind of prepared it this way was because for a lot of tabletop exercises, especially within the hospital space, a lot of people will get bogged down in the medicine and what needs to actually be done to take steps to make sure care is given to these patients, but we really wanted to focus on the reunification aspect. So we are making a blanket statement like their care is being managed. What are you doing to identify these children and starting the process of reunification? So next slide. The same thing is kind of happening here in the second inject. More patients are arriving, some with critical injuries, some with very minor injuries. Another school official accompanies these patients. And in this one, you kind of add a little different flair of 2 patients need to be airlifted out due to their higher pediatric trauma care that is needed. Both have been intubated. The school official is unsure due to the severity of the injuries on the first one, and the second one, like unsure if that child was from their school or not due to the severity of their injuries. So how does that play in? Next slide, please. And then for our last inject for session 2, again, more patients arrived, more more patients in quantity this time. One had passed away, several with smaller injuries, and several with pretty curable injuries. No school officials accompanied these patients. So again, just kind of how you would walk through these scenarios, how would you start the identification process, and how your reunification plans kind of account for these different type of waves of children entering your space. Next slide, please. Again, so we split them up into pre-hospital, hospital, state, and resources, again, for these breakout sessions, and had these questions available to kind of help facilitate what they were thinking, what they were planning to do, where gaps in their plans, partial plans, or even things that they did not realize they needed in their plans. Please move to the next slide. So again, breakout session 3 is kind of what happens when the non-patient arrival starting. So what happens when the parents start showing up? What happens when the community starts to rally to be like, how can I help? So please move to the next slide. Again, there's 2 injects with this one. Many families have gathered at the ED waiting room and other entrances of the hospital, crowding multiple areas. Families and friends start coming to the hospital. There's no clear identification has been made for many of the pediatric patients. The ED has stated that there are over 150 people in the waiting room seeking to be reunified with their potential patients that they have. So again, testing those policies, testing those plans, seeing how each institution or each service or each entity would handle this kind of wave of parents or guardians of seeking information. So next slide. And the last inject of breakout session 3 was, again, more family members have started arriving. We need to manage people and information. ED staff is busy coordinating care of the more critical patients. Do you need more staff specifically for supervising medically cleared children? School officials could be helpful, but start getting overwhelmed. Social media plays a really big part in many disasters that we see. And basically, how can we use social media to your advantage, but also how do we limit the information and misinformation coming to and from your hospital? Again, school and family members are posting all over social media, trying to figure out where their young child is. Next slide, please. So this one kind of got split into pre-hospital at this point. Didn't really have any pre-hospital specific questions as their tasks had been done. However, we did have some specific hospital state resource questions and then questions that could be considered to everyone. So this was kind of how we interacted with that. Next slide, please. And one of the things that we iterated into breakout session 3 was basically the 4 S's, which I'm sure many of you are familiar with. But that is staff, stuff, space, and structure. Like, what is your plan to deal with multiple children, no school official, and who's not able to assist with full identification of themselves? Who's managing the crowd and how? How do you have designated? Do you have a designated area where patients and parents are reunited with their children that allows for private or sensitive conversations? And then, what is your plan to deal with the expected child? So just important questions to deal with when looking into a reunification plans for larger mass casualty events. Next slide, please. So finally, the reason that I talked about sessions 2 and 3 together is because one of our lessons learned is that when we were in the live tabletop exercise, we ended up combining session 2 and 3. So a lot of the questions in breakout session 2 naturally flowed into the questions that we plan to ask in session 3. The robust conversation really helped the players naturally lead into the combination of the 2 sessions and really just made it clear to us how natural breakout session 2 and 3 were together instead of being separate. One of the other lessons that we learned was like keep the scenario pretty basic, focus on the reunification exercise at hand and not the medical treatment. I know a lot of us are trained to seek out the medical side and medical needs of these children, but to be a true reunification exercise, you really have to make large assumptions to keep it pretty basic to make sure that um, the reunification aspect of the exercise doesn't get lost within all the medical jargon. That and it's just easy for everyone to like lose track of those tiny details. So next slide. One of the other big lessons that we learned is that have motivated moderators. So having motivated moderators for virtual breakout rooms really allowed for this kind of hybrid session to really come to life and be as robust in conversation as it was, so that we were able to really kind of dig in deeper to each conversation in each breakout room. So then when it came to breakout room report outs, um, each group kind of participated at full capacity, wanted to have their insights heard and shared. And so in with having an elected moderator instead of just throwing people into a breakout room and being like, one of you is going to have to report out to the group when you're done, kind of like classroom style. This really, really helped with the connection between the virtual audience and the in-person audience. And then one of the other lessons learned was understanding of roles. Like through this tabletop exercise, everyone was better able to understand their roles in the reunification process. Like what role does EMS play? What does the hospital play? The healthcare coalitions, and also your volunteer organizations. Like during these mass casualty events, it's all hands on deck. Everyone's wanting to help out. So figuring out who does what and how we get to this kind of streamlined process, it was really interesting. And I think everyone in the room, in person and virtually, really enjoyed the understanding of the different parts that people play. Next slide, please. We also ended up doing a hot wash. So we kind of put it into strengths and areas of improvement. So for our strengths, like longer report outs with the larger groups after each breakout session was very helpful for a robust discussion. This was an all-day exercise, and the report out sessions were so lengthy in discussion and feedback and just kind of countering, that it made time fly by so fast because everyone was so engaged and interested. It also helps that we had great presentation speakers. We had the fire chiefs from that took part in leading the Waukesha parade incident down here in Milwaukee. And then we also had a lovely emergency operations manager from the Mayo EMS system come in and basically just kind of educate on, here's what can happen at a scene, here's what we do in a normal ambulance event or EMS event, what constitutes as a mass casualty, and just kind of the interesting and thoughtful questions that flow there. Having a collaboration of different disciplines present at each table helped provide expertise and discussion. So we had some people from the city, from folks from the county, the state, EMS, also your volunteer organizations outside just EMS and hospital folk. We also decided to have resources, ideas, scripts, and plans and approaches available to take back to home institutions for help with their continued reunification planning. So a lot of the people in the room were really interested and really just kind of wanting to get more information and be like, how do we be more prepared? We want more information, but don't know where to start. So having those resources at the ready was really, really beneficial. And now with every event that takes place, we always have areas for improvement. So one of the suggestions was to extend this exercise into 2 days, as we were unable to discuss all the breakout questions that we had during the allotted breakout time. So being able to basically spread out the exercise just to allow for the full coverage of everything that was being discussed was one area of improvement. To set a time for report outs and the pre-assigned reporter for the table. So the time that we allotted for the report outs ended up being much smaller than what we actually needed. So being a little more cognizant on expecting some really cool and robust conversation. This exercise primarily focused on younger children, so adding older children into the mix. And one of the areas that was suggested was to include more community partners. So like your schools, your transportation companies, sports and travel activities, a lot of, like, for example, this was a field trip. So your teachers are always going to have a go bag. Your coaches are always going to have a list of who's going to be on the bus and who's not, and they always do head count. So they're going to be great help in these mass casualty events that particularly pertain to children. And then organize tables by discipline and geographic location rather than mix of collaborators. So while virtually we ended up placing people into pre-hospital, hospital, and state and resource just to kind of make sure we really gather our ground. But when we were in the room, we decided to, all right, we have some people from this location, like some people from Duluth and some people from Superior, like they're all gonna be at this table or in the same system. So we're all gonna put them together, but we decided organizing tables by discipline rather than actual city or location may be better for conversation with all of our collaborators. And then increase our invited speaker presentations to an hour. We wanted to give folks like a time to speak and present, but again, unanticipated was the amount of robust conversation that was happening, the great and thoughtful questions that were coming up. It was just a really truly wonderful experience to be a part of, and I think allowing time for the speakers to really get comfortable and give them a little more time to explain and give more detailed answers to everyone in the room, I think would be really beneficial to this exercise. Next slide. And then lastly, we have tabletop materials upon request. We have the situational manual. We have the PowerPoint slides. We have a flyer. We have an after action report that is coming soon. I was on vacation all of last week, so I am slowly playing catch up, but we are almost done with that after action report and would love to share. And like I said, please contact me at my MCW email for these materials. But again, all of these are highlighted in the pre-session Padlet material. But that is it for my presentation. Do we have any questions?
Holly, thank you so much for describing with detail that hybrid tabletop exercise you did. Thank you so much. It looks like it was really well received. I would like to open the floor now for any questions from the group. You can either type it in the chat or come off mute. For any questions if you have regarding logistics for planning or even execution of the tabletop, anything about it whatsoever.
Hi, Holly. My name's Rachel. I am at Cardinal Glennon Children's Hospital in St. Louis. We also do a lot of cross-state collaboration with Illinois. I'm not sure if you're familiar, but you can like see Illinois from our hospital practically.
Yep.
So, and I also used to live in Milwaukee, and so it's fun to hear about stuff that you guys are doing there. Did you find, and I may have missed this in your presentation, but did you find a equal counterpart in Minnesota to support the planning, or did you lead it in a way that was like primarily from Wisconsin and you just got them to buy in? I'm curious about like who else was on your planning team.
So great question. So Region 5 for Kids, it kind of encapsulates, so there's Michigan, Ohio, Indiana, Illinois, Wisconsin, and Minnesota. So we have another Minnesota Region 5 for Kids reunification counterpart, which is actually a big help with Dr. Gupta here helping me moderate today. She was a big help in this planning presentation, but also would like to give a big shout out to Dr. Anna DePompolo. She was with Minnesota Children's, but she's now since gone to Mayo Children's. And so she was really helpful in the planning process as well to get folks on board from the Minnesota side. But I will say we did have a very large advisory committee. So it primarily like the folks at Children's Wisconsin, Children's Minnesota, Mayo Children's, but also like our healthcare coalitions really helped out. Minnesota Department of Health, Wisconsin DHS really stepped up to give connections and make sure the right people were in the room and made sure that this reunification tabletop exercise really hit the market that we were trying to aim for, and that was truthfully so prevalent in the room at the tabletop exercise that we got a lot of the really good people in the room.
Thank you, Holly. And Rachel, to piggyback on that, we did have monthly meetings with kind of this large advisory committee with both the Wisconsin and the Minnesota counterpart. So that way, everyone kind of knew the stepwise approach, knew kind of the SITMAN, knew what the PowerPoint was looking at, and everyone had an opportunity to provide feedback. So when planning one of the cross-border tabletop exercises, of course, those meetings start much, much earlier. So just making sure we have those names, those contacts kind of from the beginning to start that advisory committee meeting. Great questions. Anything else? If not, we'll move on to our next session here. Thank you. Now we are going to go over the DRC virtual tabletop exercises for reunification that we've had, and we are going to have Chris, Brittany, and Christy presenting here about those. I want to introduce Christopher McCarthy. He's the Drills and Exercises Domain Manager for the Pediatric Pandemic Network and the Arizona Coordinator for the Western Regional Alliance for Pediatric Emergency Management, which is RAPA. He designs and facilitates the pediatric disaster exercises for that hospital. Brittany Blazer is the Healthcare Emergency Manager for Children's Mercy Kansas City. She's also one of our own reunification domain leaders for the Pediatric Pandemic Network. And Christine Deutschman, she's the Reunification Domain Project Manager for the Pediatric Pandemic Network. And she's also the Program Manager for the Pediatric Pandemic Network hub site at Cardinal Glennon Children's Hospital in St. Louis, Missouri. Both Brittany and Christy were actual observers for the reunification virtual tabletop exercises. It's a lot of work. Each exercise is 3 to 4 hours in length, and they subsequently have to take meticulous detailing and note-taking to share with us as the group. So I welcome Chris, Brittany, and Christy.
Thank you, Nita. I appreciate that. And today I'm excited to share some data now from these exercises. I see a lot of familiar names in the participant list, folks who were either players in one of these exercises that we hosted for the DRC, or those superstars out there who were a facilitator or an evaluator for their own facility. They really put in the work, and it's good to see a bunch of you here. So I'm going to talk a little bit about the format of the exercise that we hosted across all of the focus areas for the DRC. And then I'm also going to talk through the data that we received from participants, specifically the participants that could could have been players, facilitators, evaluators, that participant feedback we gained after each exercise. Again, I'm going to go over that data for reunification. And then we even have a preview of some of the data collection from the DRC, asking questions about the outcomes, what might have been in the after action reports or discussed in the hot washes for these exercises. So like you see on the screen, this is just kind of a broad overview of all of the exercises, and the format was the same, a 3-hour discussion-based tabletop exercise. So just like we were hearing earlier, the focus really wasn't, the actual care that was provided to patients in these scenarios. The focus of these exercises, these virtual tabletop exercises, really was the plan, the policies, the procedures that each facility already had in place. Whatever form that might have been, because this exercise was really an opportunity for those facility teams to explore those existing reunification plans, what policies are in place, what's been done with those before, have you used those, have you activated those, and then of course, where there might be opportunity to continue to improve those reunification plans. The topics, again, in this case, the topic was reunification, so we came up with brief scenario injects for our 3 module breakouts. On the discussion questions, we really formed those based on the EIIC's essential checklist for every hospital's disaster plans. We looked at the reunification domain and really came up with some questions that helped participating facilities, those that attended these VTTXs, it really helped them think about, in the context of that checklist, what EIIC recommends for activities and what to plan for in reunification. Those facilities got a chance to check against that checklist and talk through what is or isn't in their plan. So again, zooming down to the reunification topic, for those of you that are here in this focus area, 5 of those 15 scheduled exercises that we hosted for the DRC, the virtual tabletops, 5 of those were reunification. So those were that was the standout show up. That was the most VTTX dates that we scheduled for any focus area. Some focus areas had 4, some had 3. It was really dependent on the number of participating facilities in each focus group. And so shout out to Reunification, especially the leadership here, a very engaged group. We had 5 exercises, and then as you see here, 14 unique facilities that participated across those 5 dates. The exercise players, this list is just based on kind of an informal poll I would take at the beginning of each virtual tabletop exercise. So whether the participants were joining virtually, we also had some facilities that would gather a large number of people in person and join the Zoom environment as a large group. We would poll everybody right before we started exercise play, you know, who's in the room. And these were just the most that I took down. I think there were a few others that were mentioned that I may have missed, especially community partners. I know at least 1 or 2 facilities had the opportunity to invite in either whether it was a healthcare coalition or some of their pre-hospital partners, transport partners. So this is just a short list of some of the facility teams that showed up for those facilities that joined these exercises. So I mentioned we collected participant feedback, and it was a short 4-question survey that we posted at the end of exercise play for each of these virtual tabletop exercises. I'm going to talk a little bit about the outcomes, the results that we got from that participant feedback, and then the last couple of slides that I'm going to show here in a moment talk about a separate data collection survey. So I just wanted to call out that difference. We're talking about 2 different data sets in the next few minutes. So first, we'll talk about the participant feedback. We had, out of all 15 dates, we had nearly 380 respondents. So that's just a reflection, a small conservative reflection of how many total participants there were. We realize not everybody has the opportunity or takes the chance to respond to our participant feedback. So that is probably an undercount of the total participant number across those 15 dates. But again, all in, it was 379 responses that we got, nearly 380. Of that, 113 of those responses were specifically from one of those 5 reunification dates that I just mentioned. The survey format and the participant feedback was 3 ratings questions, a scale of 1 to 10 rating, and I'll show the average ratings in a moment for those. And then there was just 1 open text response for, you know, what did you think? What could be done differently? What stood out to you? And we got some really cool feedback, and I'll share a little bit about the sentiment that we received in those comments too. So these are the 3 questions that we asked for ratings, again, anywhere 1 to 10 from the participants. Really across the board, it was a mean or average score of 8.0, 8.2 on the last one of just rating the hosting there, so thank you. That was similar to the median score there too, so it was a good reflection of just how valuable this experience was. We know that not every facility that was in each of the focus areas for DRC took advantage of this option. Some, you know, participated in the Region 5 exercise perhaps, and then I know there were a number of facilities that held their own reunification drill exercise, may have even participated in a large scale or community exercise for reunification. So again, these are just scores and ratings about the virtual tabletop exercises that I had the chance to host. And generally speaking, this was just as good, if not maybe a little better than what we expected for the scores. Again, these are just the folks that may be here, the ratings from the reunification participant feedback surveys. And then on the comments, this was kind of cool to do a quick analysis of the sentiment. Generally, overwhelmingly positive. It was over 60% of the responses were, again, this is just a sentiment analysis of the free-form comments, not the ratings. Over 60% of the comments were positive in nature. a high 20, I believe it was 28% were neutral. So, you know, kind of indifferent, but nothing bad to say, nothing outstanding either. And then just 9% had some type of negative sentiment in those comments. And I'll tell you, I didn't put the negative comments on here. If anybody wants to hear about them, I'd be glad to share. This was all anonymous, but a number of those negative sentiment comments were actually about not enough time. So many of the facilities or the participants, the players that responded said, you know, just 30 minutes to discuss, you know, that one scenario or that one aspect of our disaster plans. We would have liked more time. I think one person said an hour per module would have been great. We have to balance that and recognize that we can only hold people's attention for so long. But again, if that's the worst thing, is that they would have liked more time to play and have to discuss these plans, I think that's a good fail. And I think that's going to be shown through some of the opportunities in these sessions where you really get to continue to dig into your reunification plans. And then I'm not going to go one for one, but you can see the comments out here. I just really appreciate a lot of the teams reinforcing that what we set out to do when we designed these exercises with the DRC team, it was, again, a focus on the plans, an opportunity to talk through what is in our reunification plans now, what have we used before, what are we hearing, you know, potentially from sessions like this that we should be adding into our reunification plan and continuing to build out. The vast majority of positive comments were all about how much people enjoyed taking time with just the plan, no fault environment, just an opportunity to talk through what's on paper or what should be added to the paper for the disaster plan. I don't have a view of the comments here, but I'm just going to double check. Were there any text chat comments, questions?
Nothing at this point, Chris. Thank
Awesome. Thank you. So next, I want to take a moment. I'm going to be honest, this is preliminary results. A separate survey, separate from the participant feedback that I was just talking about, the DRC is sending out a data collection questionnaire, and this is going out to all DRC participating facilities. So regardless of what modality you did for the exercise, whether you participated in one of the hosted exercises that I was just talking about, or you held your own, participated in a community exercise, every DRC participant facility is receiving this data collection questionnaire that really digs into the plans. You know, what were the outcomes from that exercise? What did you find was working well, a strength in your current reunification or patient tracking plans? And what are some of those gaps? And then asked about action items. What are you doing next to improve the plans? Those surveys just started going out in the past few weeks. Those questionnaires were sent to DRC team leads. If you had a named evaluator and facilitator for like one of our exercises, they would have also been copied on that email from the DRC. But as you can see, just in these preliminary results, I'll say that it looks like activation and resource needs. Somebody felt that was definitely a strength for them. One of the other standouts for me is that kind of split strength and opportunity or gap for policies and written procedures. So really, again, in this exercise, at least the ones that we hosted, it was an opportunity to do just that, focus on what is on the paper, what isn't in our plans, where should we be adding some capabilities and some resources in our reunification plans. So more to come on this data collection questionnaire from all facilities, and I'd imagine that you'll be hearing more and more about this data as more people respond to this data collection questionnaire. So that's where I'll end my comments today before I turn it over to Christy and Brittany is please, it is a facility-specific link, that data collection questionnaire I was just talking about. So DRC team leads, again, if you attended one of the hosted VTTXs, it would include the facilitator and evaluator that was identified, but that 1 to 3 people would have received a email with a specific link for your facility to respond to that data collection. So if you're a team lead and you haven't seen that email yet, if you attended one of the virtual tabletops and you haven't seen that link yet, please do reach out to the DRC inbox I have here on the slide so they can make sure they get that data collection questionnaire to you. So I'll pause, see if there are any questions, or turn it over to Christy and Brittany.
I think we'll move forward just for the sake of time.
Sure.
If you'll allow me to, can you stop your share, please? Thank you, sir.
Good afternoon, everybody. Anna gets my slide up. That'd be great. I just wanted to thank everybody that we've got a wonderful turnout this afternoon on this call. So thanks for joining. Brittany and I, between the two of us, we were able to join at least, one of us was able to join at least every single one of the VTTXs that Chris hosted. And these were kind of things that we noticed when some of the bigger VTTXs, we went into one of the breakout sessions. Sometimes we switched the sessions we went into, but sometimes we stayed with the same hospital the entire time. So these were our observations from just a complete third-party source, if you think we're a third-party source on this. Unclear roles and activation. We heard several comments about people knowing about HICS and where reunification falls in the HICS structure. A lot of people questions, when do you activate your reunification plan? What is that trigger? Is it one unaccompanied minor, or is it 10? So we heard a lot of those comments. Parent guardian verification gaps. There was a lack of standardized process for verifying the identity, especially for non-legal caregivers. There was a lot of discussion on what is the criteria, who do you call, and what are those factors that you need to verify to make sure that that is the legal guardian or the parent of the unaccompanied minor. A little bit on specific supplies and needs in the area, and it was mostly in the pediatric safe area. Gaps in staffing. We know staffing is going to be an issue in any disaster. So gaps in staffing, where to hold those secure areas. Do you have enough supply of cribs? If it happens to be an incident that involves a daycare center and you have a lot of children under the age of 2 or even under the age of 1. And then do you have enough credentialed child care support to work in that pediatric safe area? Another one was call center readiness. Do you have a location for your call center? Do you have scripting, pre-prepared scripting? How are you communicating from incident command to the call center to keep them updated on what's happening and what's going on? And like I said, in their information sharing policies, a lot of that was undefined. People could talk to it, but everybody had questions, it seemed like. Technology and tracking systems, a need for interoperability and staff training and testing. A lot of the hospitals and stuff talked about, oh, we'll do it in our electronic medical record. And it was, the question came up is like, but is there enough information in that electronic medical record to be able to identify and track and match them up? We know from the science and everything back behind it, if you don't have pictures that you can upload into there, how do you identify? We know that eye color and hair color aren't necessarily a really good place to match somebody on, based on everyone interprets eye color and hair color just a little bit differently. And then community coordination. People talked about they had partnerships and stuff with schools and their law enforcement and their local community. But nobody ever really said that they had it in writing, or that they had previously reached out and practiced and planned with their community planners and their community coordinators. So those were the big gaps and the big things that Brittany and I saw and observed. Brittany, do you want to add anything else?
I don't think I think you kind of hit all of the marks. One of the things I know that did come up is really just the testing. Like, a lot of people have formal plans or some sort of process on paper and it looks great, but really just kind of making sure that we're testing those processes so that they will work during a real event.
Nita, we're going to turn it back over to you.
Great. Thank you so much, Christy, Brittany, and Chris. That overview for the VTTXs was great. I now want to kind of shift the discussion here to the larger group. We would love to hear about your personal experiences from your hospital's VTTXs. How did they go? What were some strengths? What were some challenges? Open it up for collaboration, discussion. Any questions that you may have about that now? Give me a few moments. If we have no volunteers, I will choose a person.
I was going to say just what Anna said. We're in a safe place, so please come off camera and chat with us. We'd love to hear from you. If you're having issues coming off mute or whatever, put some comments in the chat or raise your hand and we'll make sure you get unmuted if you can't come off mute.
I can go ahead and share reflections from our experience. My name's Nick Lom. I'm pediatric emergency at UCSF, University of California, San Francisco, and we joined the tabletop back on June 10th, and we had participation from our emergency management, our ED clinical and emergency leadership team, spiritual care, security. We had the unfortunate situation that we were just coming out of a Joint Commission's visit and going into a labor action with the university. So we did have absence of our child life, behavioral health, and social work. So certainly an opportunity, I think, for us going forward is to make sure as best as possible that we have involvement of those services also in these type of trainings. I think, for us at UCSF, we feel our family reunification plans are somewhat mature in terms of our checklists, our patient tracking, our family interview forms, identification of the spaces and supplies. But certainly, next step for us is really making sure that we include the training of all staff throughout the hospital for family reunification, and all the different tasks that they'll be likely to support. I think this probably, my guess, a lot of this fell to the wayside, maybe during the COVID pandemic, but certainly re-engaging all the different service lines within the hospital to make sure that everyone is up to speed and knows exactly what they need to do. And that goes, making sure everyone understands their potential roles and responsibilities. And again, I think by doing future exercises, we'll be able to tackle this. Certainly, we identified a major gap. I don't want to say identify. We knew it was there, but we highlighted a gap in our reunification coordination with outside entities such as the San Francisco Department of Public Health, San Francisco Emergency Operations Centers, or the Joint Information Center. And so we just need to clarify between plans and communication pathways, and just make sure that we know how public messaging is going to be coordinated within the region, within the city. And that's going to be a vital next step for us as we exercise and practice this internally. And then, certainly, I think there were some opportunities to fine tune how technology can be leveraged to support patient tracking, including the use of QR codes, adding identification photos, et cetera, to the system when possible. So overall, I think it was a very positive experience for us. We learned a lot, not just from within our team, but also from listening to the other sites sharing their experiences and resources. So it was incredibly well run. Chris and team did a phenomenal job, as always, running the virtual tabletop. And yeah, just look forward to continuing to be a part of this.
Nick? Oh, hi.
Hey.
Hi, I was waiting to hear from UCSF. Hi, I'm Regina Yaski, Rainbow Babies and Children's. You actually answered part of my question. You talked about how you leveraged technology with patient tracking. How were you guys able to deal with patient tracking on the pre-hospital side? Is this something you addressed during this drill? Or
Yeah, I think better coordination certainly with the pre-hospital. So we have ReadyNet. ReadyNet is our patient tracking system. And so ideally, in a perfect world, the pre-hospital is entering these patients into ReadyNet. And this is, ReadyNet is used regionally. And then when they arrive, they would be confirmed that they're in our, that we have the patient at Benioff Mission Bay, and go from there. I think so. I think when we do future exercises, including Department of Public Health, including our pre-hospital, to make sure that all those, there's some assumptions I think that are out there that this is going to be done. And so actually drilling this, practicing this, and making sure that it is being done appropriately,
Absolutely.
and that we can coordinate. Yeah.
I think
Thank
one
you.
of the solutions that we had was to
Mhm.
actually our pre-hospital folks have a tag for each patient. And
Mhm.
so we actually now have a flow sheets kind of thing in Epic where you can actually put that tag number in.
Mhm.
So it links the patient with the tag, which is the way that our county tracks patients. So just a thought, it's a very
Wonderful,
easy
thank you.
build if you're using Epic, but it could just as easily be a field in Cerner or any other electronic health record.
Wonderful, thank you. Stephanie, hear that? Great, thank you.
Great thoughts, great ideas. Thank you, Nick. Anyone
Thank
else
you.
with their experience, and even someone who maybe didn't do a DRC hosted VTTX, if you just did one with your home institution at an earlier date, any strengths, areas of improvement, lessons learned, please share.
Anna, this is Tim Skolton from Helen DeVos Children's Hospital, and we use the same technology of entering in the tag numbers into their Epic chart when they get registered. One of the questions that we couldn't answer with the group of people that we had there, and maybe how searchable is that? It's great to have that tag number in there, but if I'm just looking for a tag number, is there a way to search all of Epic for that tag number without going through each individual chart, opening it up and looking for it?
Yeah, I think it's hard. We
Mhm.
have the way that there's certain ways that you program with an Epic, and I'm gonna just kind of go into Epic a little bit here, so apologies. If you use Workbench, then you'll have to actually do a Workbench report and create that. We actually have custom, and so we can generate our own reports based off of flow sheet rows.
Thanks, Anna. Thank you, Tim. Any other questions, Tim?
Oh, questions, I don't know, but oh, I see Marissa put her hand up.
Yeah, so we also use Epic in our system, and I actually have a meeting about this because of these meetings next week with our Epic representatives and everything. They told us that you can search the tag number similar to how you would search a CSN or an MRN. How that works in real life, if it actually does work, how it's supposed to, I don't know, but that is what we were told. If that
Okay.
helps.
Yeah, it was one of the things that we took away from it. Went through the exercise. We also, as already mentioned, another thing that just making sure that we have a good process for how to reunite people with their parents and make sure they're the right parents. That happens on a daily basis with guardianship and situations like that we all deal with which parent shows up at the ER to address their child, and if they actually are the guardian or not. But in this scenario, what would we use to make sure that we have the right parent with the right child? So that is something that is a takeaway for us to work with our social work department to make sure that we have that ability to do that on a fairly large basis, and not just as we jokingly said, anybody who's willing to take the kid can have them to get them off of our hands. But we probably should make sure it's the right one so we don't have that headache down the road a little bit. This came up and we went down this rabbit hole when we started talking about staffing the safe area for the children that are waiting for parents that are unaccompanied. I've always believed in any of our drills that we will have plenty of staff will come in for these types of disaster scenarios, and our labor pool is probably what we need to work on a little bit more. I know that people will show up, and actually as an emergency management person, I worry more about what happens in the 12 to 18 hours after the event, when people have flooded into the hospital to help out and they're helping, and now they're getting tired and they want to go home, and who's going to be left to do the next shift kind of situation. I'm always worried about the next shift from a disaster preparedness perspective. But we really need to continue to work on that staffing pool and how we make sure that we can get those people to the right spots. When we drilled the staffing pool, we end up with a bunch of people in the cafeteria waiting to work, and they never get to where they need to go to because we don't have a good process for getting those people to the, in this case, the safe patient area to help staff the kids that are down there, and even the emergency department in that perspective. So a couple of things we discovered through that have come up in other scenarios that we just need to continue to work on. I think the other one that I know that we talked a little bit back and forth after the fact with Christy was the whole idea of, and we may have misread the slides on this one or not, but what kind of, we're prepared to take care of all the unaccompanied minors that come into the hospital through our process, and we know that those are our kids, are our responsibility. But would we take any responsibility for an unaccompanied minor who came in that wasn't part of the event, but parents needed to go and do paperwork, or needed to go find the child or go see the child up on the floor and be reunited? Would we help by taking any responsibility for the other kids that came in with the parents at that time? So, it wouldn't really be someone who we would register or take responsibility for because they weren't part of the event and they came in with their parents, but now their parents are too busy. Do we have any ability to, put them in the safe patient zone, or, somehow watch those kids while their parents are busy taking care of the injured child? And we did not have an answer for that.
I was going to say, I think Anna and Sarita both answered that in the similar way that I did. So you set up childcare within your family reception site.
Right.
And no, you don't take responsibility for those accompanying minors. You keep them in the same area and away from your PSA.
Amy also had a question about, I think you said one of the gaps you guys had was how do you confirm that these are the right parents or the right legal guardians of the child? One of the things you can leverage, so you talked about social work, leveraging your social workers. You can also leverage security. And this is also a time to leverage schools as well. If you know what school the child attends, this is where the teachers, the school administrators come in handy, because they would know who the legal parent is. They would know who the legal guardian of that child is. So schools in the area are very helpful in reunification. So it's always helpful to kind of know your community. Yep.
Yeah, that is true. We did point that out. If it was a school, the school knows who the parents are, and they can go to their records and tell you, yes, Tim Skolton is Ricky's dad. So yeah, we did tap into that as a potential solution from a school perspective.
Yeah, we have those, and then we have security as well, because they can kind of help you to work with also maybe local law enforcement if there's like a, we get that in the ER all the time. You're not sure who the legal parent is. Security can help you with that too. So that's something.
Thank you so much, Tim. Thank you, Regina. Do we have the slides, Anna?
So hang on,
worries.
we have one more poll, and then we're gonna get to the real business of the DRC business here. So we did things a little bit different today. We had a big, large group discussion. This just means that not as many people can speak. So we're wondering about your preferences for large versus small group discussions. Would it have been more helpful to break out into smaller facilitated group discussions? Or is the preference to have these larger group discussions? And then I think I can't see the chat again because I'm here, but we have a reflection. We have a reflections kind of Padlet to help you kind of think about what were your key takeaways from today's session. What are some challenges that you're facing currently in planning, and what you are committing to in the next month or so until we can see you again. Our next session in August is going to be a large group session. And then we'll reconvene in September. Again, just giving you a little bit of time. The poll, you can go to pollev.com/ALYN1, which will be the online version, or you can text ALYN1 to phone number 37607. And I see that Laura is putting in the DRC reunification. This poll will stay open for a little bit, so just take your time. I'm going to advance the slide to our updates. Laura, I'm turning this over to you.
Sure. So I just wanted to say something about the pediatric disaster preparedness self-assessment for children's hospitals. If you started, please proceed with it, especially if you can move forward and complete the reunification section first, because the evaluation team will pull those results out, even if your survey is incomplete, and share it with this group for future planning. It's a really important survey. The suggested strategy is to pull people that you believe will know the answers together for a 1-hour meeting and just finish it up, and share other parts to other people that weren't at the meeting. But that seems to work pretty well. Chris already mentioned this next point, so I'm not going to say it again because I also put it in the chat. Next slide, please. Yes, August 5th is the collaborative session. We're going to hear from teams about tabletop exercises, virtual tabletop exercises, people that chose other strategies. And then in September 2nd, yes, sorry, that's the day after Labor Day, we will be meeting again with this focus area. Next slide. I put in the chat the little code, the text FOSS code, if you want CE credit, and you do have 60 days to claim it, so don't feel rushed, and these slides get posted online, so you can take your time or just ask us for it later. Next slide. The session evaluation link and the QR code is on the screen. The link is in the chat. Next slide. I wanted to thank everyone who's on the oversight group for everything they do to prepare for these sessions and to participate, as well as to thank the speakers and everyone who comes every time to these sessions. They are very interesting and thoughtful, and you really do make a difference. Anna or Sarita, any final comments?
We just really appreciate your active engagement, and thank you for those of you who shared your experiences today. We are asking for folks to sign up and share their experiences at other sessions as well. Please do sign up. We'll send out that information again by email. If you haven't accessed the Padlets, they're always there for you. We'll kind of try and see if those continue to be helpful or not. So just let us know one way or another. Thank you. Enjoy your 4th of July.